So one of the great things about GentleWave technology is that the more complex the internal anatomy, the more confident we are in using that to kind of clean out all the little ramifications and connections and lateral canals that sometimes our files don't get into. And our medications don't always get down to the very tip of the root many times. So this patient presented a lower right tooth. She had a lot of discomfort. The tooth had been raised up because of the infection. So as the disease process goes through from inflammation to infection, the bacteria change, starts to get a little more acidic, starts to leak out the tip of the root, and there's a little membrane that goes around the tip of each root. And as that pressure starts to mount underneath the tooth, the infection, it starts to lift, the fluid starts to lift the tooth up. And many times patients can report all of a sudden their bite feels off. And that can always be a sign that there could be something going on with the root canal system. And you could see the large space that had been eroded because of the infection, and basically that's all kind of gross necrotic byproducts that it's not good to have in your body, obviously. And your root canal treatment is successful because we totally eliminate the root canal system, just like getting an extraction. But we're able to keep the tooth and keep you healthy and keep the bone healthy. And this is one of those kind of C-shaped molars, and we call it C-shaped literally because there's canals kind of all along, and there can be connections halfway down. There can be all kinds of different anatomical considerations that just using regular endodontic files can sometimes leave tissue behind and not get us the deep clean that we would like. And we ran the GentleWave system on this tooth, and upon filling, we got just an explosion of incredible little lateral canals here on the mesial root. You can see the little fork there. There's some interconnections between the two distal canals there, and then again quite a few portals of exit at the very tip of the root. And again, when you see this result after running the system and we fill that tooth, it makes you feel confident that you've done a good job and you've been able to keep the patient comfortable and have a good result.